Hi everyone, welcome to Module 4. In this lecture, we will cover Chapter 5, which is the chapter on arousal, stress, and anxiety. Now let's define arousal and anxiety. Arousal, looking at the textbook definition, is a blend of physiological and psychological activation which varies in intensity along a continuum. So there can be low arousal, high arousal. Anxiety, quite different, is a negative emotional state with feelings of worry, nervousness, and apprehension associated with activation or arousal of the body. So both of these are not the same, and there can be a level of arousal that can be very positive in performance, and we're going to talk about that today. In one of the earlier modules, we talked about the differences between trait and state. Obviously, traits refer to the specific characteristics that make up an individual, versus state refers to how those traits may vary based on the situation that a person is placed into. So when we talk about state anxiety, we obviously refer to the definition of anxiety, which we just addressed, but we classify state anxiety into cognitive state anxiety and somatic state anxiety. And we're going to dive a little bit deeper into these two types of state anxiety. Cognitive state anxiety refers to the degree to which one worries or has negative thoughts. Somatic state anxiety refers to the concerns that a person faces based on moment to moment perceived physiological activation. So, again, cognitive refers to how the person thinks at a given situation, obviously tied into feelings of worry and doubt. And somatic state anxiety refers to essentially how the body relationship, again, mind body relationship, is changing based on how the person is having those thoughts. Really key point here. Perceived controlled state anxiety is the degree to which one believes one has the resources and ability to meet challenges. Because again, with some level of arousal, you would expect there is some level of anxiety in many cases. So it makes sense to be willing and be eager to try to handle this anxiety. Trait anxiety is, of course, a personality disposition that is stable over time. It is an acquired disposition that predisposes a person to perceive a wide range of objectively non-dangerous circumstances as threatening and to respond to these disproportionate state anxiety levels. Now, uh, what does that mean, right? That's fancy terminology for essentially explaining what we've already said. Where specific trait anxiety, when we talk about someone who might be an anxious person, they have that trait within them. But if someone has state anxiety levels, they may just have anxiety during certain circumstances. And again, here we're just referring to the relationship between state and trait anxiety. So it's important to know the difference between the two, but also realize how both, again, the traits and the circumstances, the state that the person's in, how that plays a role into anxiety. Really important here to note is high versus low trait anxious people usually have more state anxiety in highly evaluative situations. So what that means is that people who inherently have an anxious trait or anxious traits within them, they're typically ones that are going to have more state anxiety. And I think that makes sense when we think about it. When we have someone who might be typically just more nervous, more, caring of what other people think as an athlete, they are the ones that maybe may struggle a little bit from a anxiety standpoint, particularly when we're thinking about those cognitive and somatic characteristics, than those that may not have those high traits. How do we measure arousal and anxiety? Remember, these two are not necessarily the same. Well, we can look at psychological signs, and what that really means. Aside from psychological signs, we're also looking at some various physiological signs as well. So what that refers to are, psychological signs as a result of certain specific physiological findings such as heart rate, respiration, skin conductance if someone's starting to develop really sweaty skin, biochemistry if someone's the makeup of what's going on underneath the surface, biochemically speaking, if that's changing based on how a person is reacting. There could also be various subjective measures, global and multidimensional self-report scales, essentially questionnaires that we can use to measure um, different levels of arousal and anxiety. Emotions, similar in this train of thought, but a little bit different. Emotions, we look at those, and again, looking at a very popular definition from Lazarus that comes right from the textbook. Emotions are an organized psychophysiological, so again, there's a psychology component and a physiological component, reaction to ongoing relationships with the environment, most often but not always interpersonal, social, involving subjective experiences, observable actions, or impulses to act in physiological change. So a lot in that definition, but if we take it apart, we can see that again, there are physiological, psychological components to emotions, which we know. And of course, there are aspects of trait, and there are aspects of state, environment that go into this definition. So again, understand that emotions as a whole, a rather complex definition with various factors to consider. A couple of things about emotions in sport and exercise psychology, particularly in sport. Emotions can be positive and negative. I'm sure you've heard about positive and negative stress, right? Positive stress being eustress, negative stress being de-stress. So obviously these can tip the scale one way or another in terms of the effect that it is having on an athlete. Some emotions that are very common in sport include anything that, there's only a select few. There's many more than these, but, typically we have athletes that may experience anger, anxiety, fright, guilt, shame, sadness, envy, jealousy, happiness, pride, relief, hope, love, gratitude, and compassion. And the list goes on and on and on. um, some specific emotions, but and as an example, we have there anxiety, anger, and happiness have tied have been tied to specific performance changes, either positively or negatively. One of the earlier modules this semester, we talked about how having a positive climate and reinforces achievement motivation. And depending on the climate that you have in which an individual competes or trains in, of course, that can bring up some certain emotions. So you can see right away how some of these things are very quickly tying in together. And needless to say, sport and physical activity participation influences emotions. I think that's pretty straightforward. Stress. I just brought up stress. How do we define stress? Well, stress, whether it's again positive stress, eustress, or negative stress, de-stress, stress we look at as a substantial imbalance between physical and psychological demands placed on an individual and his or her responsibility, capability under conditions in which failure to meet demands has important consequences. Notice that last part of the definition, important consequences. Consequences aren't necessarily always a bad thing. Sometimes there needs to be, again, some of that positive stress in order to learn, to grow, to develop certain skills. When we look at stress as a process in terms of how someone is working through a stressful situation, stress process, we define it as implications of the stress process for practice, which what that means is as someone is dealing through a stressful situation, this is the point in time in which there can be intervention points from the individual person, from people on the outside, which can help to either alleviate the stress process stages or to perhaps be detrimental to the stress process changes. Let's talk a little bit about sources of stress and anxiety. There can be situational sources, there can be personal sources. And if you look at some of the examples and you start thinking about these examples in the context of sport, I'm sure you've heard of many athletes that have had these significant sources of stress and anxiety in their careers. Event important situation and sources, right? The championship game, right? Training for the Olympics, a playoff game, an important game. Maybe it's a game where a family member is coming to and they want to perform well, and so on and so forth. Uncertainty, great example now, COVID-19, not knowing whether or not sports will continue, not knowing the health of certain teammates of themselves, of coaches. All that ties into a lot of stress and anxiety. Looking at some more personal self-reflective sources, trait anxiety. If someone's just naturally a anxious person, right, develops characteristics that coincide with anxiety. In one of the findings we discussed earlier, we know that individuals with higher levels of trait anxiety will have higher levels of state anxiety. Self-esteem. If someone has poor self-esteem, not a lot of confidence in themselves, of course, that's going to bring on a lot of stress and anxiety. Social physique anxiety. One of uh, one of the few examples of many in situations where individuals may, perceive themselves as lesser than their counterparts, as not being on par, whether it's for some sort of physical ability or technical ability. And of course, that could definitely be a pretty significant source of stress and anxiety. So now when we start looking at, or the fact that we've already looked at some definitions of stress, arousal, anxiety, we're going to talk a little bit about now um, some predictions and some theories of how these different elements come together to increase or decrease performance. First one we're looking at is drive theory. So drive theory essentially states that as an individual becomes more aroused or anxious, their performance increases. Now, what's important to note is we're going to look at some other theories and other predictions, or just other theories, I should say, today. And you'll notice that although some level of arousal and anxiety is important for performance, and there is some sort of correlation between positive performance and increases in both of those things, it gets to a point because again, once a person doesn't have the coping mechanisms, the technical mechanisms to handle that arousal or to deal with that anxiety in competition, then we start to see a significant drop off. So this theory is used as, and we used this as an earlier example in the beginning of the semester, for something known as the social facilitation theory. And this theory simply is that the presence of others enhances performance on simple or well-learned skills. So when someone does something in front of others, think about a crowd, a team, maybe the people they're training with, right? A smaller group of teammates, and it's something that it's easy for them, something that they've done many, many times before, their performance increases. Versus in performance inhibition on complex or unlearned skills. So take that same group of people, if the athlete is doing something that's very difficult, or if it's something that they've never done before, they're trying for the first time, then the performance decreases. And I think that is an interesting thing to consider because let's look at this theory in the context of another example. Let's say if you were a musician and you've been playing the guitar for 10 years and you're very good at playing the guitar and you learn a song on the guitar and it's a song you've played countless of times, you've played it countless of times before. So in theory, particularly in the lens of the social facilitation theory, you get put up on a stage, tons of people there, tons and tons of people, maybe 100, 1,000, couple thousand, whatever you want to think. You start playing and you're comfortable. It's a simple, you've done it before, you know the chords like the back of your hand, you know the rhythm, got it all down, so your performance will increase. But let's say if same stage, but now someone gives you a ukulele. And although you might say, oh, I'm sure there's some similarities there, but it's a totally different instrument and you never really used it before. It's a complex skill for you. Then you start getting nervous. You start looking around. You start making mistakes. It's a skill you haven't learned before. So then your performance will definitely decrease. And I know, maybe that's a little bit of an extreme example, but, take that idea and think about how it translates into different avenues of sport. Home field advantage. This is really interesting. So this is something that we hear a lot in sport. When you think back and look at, like win-loss records, win percentages, that sort of thing, a clear home field advantage has always existed for professional and amateur team sports and this advantage has gone back almost 100 years. That's pretty incredible. Um, and this advantage occurs regardless of team or individual sports. So whether someone is, let's say, playing tennis, bowling, or football, basketball, or if they're male, female athletes, that home advantage is still there. However, when the situations become more pressure induced, right, there's a little bit more weight to the competition, there's a proposed home field disadvantage. But the evidence supporting this is mixed. So think about this. What did we just talk about? Social facilitation theory. let's say in a non-pressure situation or not as much pressure, right? Let's think about the regular season, right? Think about traditional sports, maybe at the college or professional level, even at the high school level. Regular season, teams treat skills that they've done before as skills as they should. To them, they're simple. They've learned them before, right? They focus on what they've learned. Um, so they're comfortable and they're able to obviously succeed and improve performance. So they have a little bit of that advantage. But then think about the playoffs. Think about now situations where although they're still doing the same skills that they've done all season long, there's more pressure there. So they start making things more complex. That's why, one of the things, and I'm sure, any of you that have seen sport and then whatever sport's your favorite to watch, maybe it's halftime or in between an inning or period or whatever. Sometimes they interview coaches in between, and let's say the coach is not performing well or their team's not performing well, and they ask the coach, you know, hey, what do you need to change coming back in the second half, or what do you need to change, when you come back out of the locker room? You might hear something along the lines of, we need to slow the game down. And you might say, well, that's just something that they say doesn't really mean anything. But, if you don't take it at face value and you dive into what exactly that could potentially mean, if you slow the game down and you start making the tasks that the team is familiar with more simple than complex, in performance will improve, especially based on the social facilitation theory. So that's a very important thing to know, particularly as we're looking at some of those changes throughout the course of a season. Now, a couple other things that are really interesting about home field advantage. Look at this. Non-sport research supports the idea of championship choking as a result of performance self-consciousness. So when someone becomes aware of maybe the mistakes they make and they get in their head, for lack of a better words, and they start to really just self-evaluate what they are doing, they get caught up. Again, they're making the task too complex. Although it's a skill they've done many times before, they overcomplicate it. Here's another important uh, fact. Athletes bound for playoffs should have well-developed strategies for coping with anxiety in order to prevent negative attentional effects that interfere with performance. Coaches, athletes, they know the stakes are going to get higher. So particularly those, at the more elite levels, they need to develop these strategies that are going to help them once they make mistakes, once they realize that they've have made the tasks that they've done many times before a little bit more complex. And some of the things that we'll talk about throughout the semester are things that when athletes and coaches can't do it on their own, they'll bring in a sport and exercise psychologist to teach coping strategies for athletes to be able to simplify tasks, to be able to reduce their anxiety, to be able to narrow their focus, particularly in situations where the stakes are higher. Because again, we're going to see, and we already started this discussion today, arousal, anxiety, even a little bit of stress is good in performance, increases performance, but to a point. When the coping mechanisms can't handle an increase of those factors, that's when you start to see a decline in performance. Here is our inverted U curve as it relates to physiological arousal. So what does this mean? Again, think back to arousal and the definition we had there. Again, there has to be some level of arousal that increases as performance increases. But again, once it gets to a point where the coping mechanisms can't keep up, then you start to see that decrease. So we want to see as much as possible. And, there's going to be fluctuations within a season, within a game, and so on and so forth. But what we want to see is, again, we want to keep our athletes right in that middle portion. We want them to be aroused, have some level of anxiety, some stress, just enough that their coping mechanisms can hold them, can sustain them beyond going on to this part of the curve so that we can keep that performance high up, right? Because we want to be here. We want to try to maximize performance. So this is our bread and butter. That's where we want the athletes to stay. Not always easy. Consider, we consider a lot of things, but one of the findings we keep saying today Remember, people with trait or athletes with higher levels of trait anxiety have higher levels of state anxiety. So what does that mean? They're perhaps naturally they're more of an anxious person. Their arousal goes through the roof, even if it's a minor circumstance. Right away, they're dealing on this right hand side of the chart. So naturally, their performance is capped. So again, just something like that makes it very easy to understand why, again, some level of arousal, stress, anxiety is good, but too much of that is what is, preventing people from performing at their highest level. All right, let's look at another way to consider anxiety. So we have something known as the multidimensional anxiety theory. So think back to, we said the differences between cognitive and somatic, where typically cognitive was related, cognition related to thoughts, somatic related to, again, just that change in body-mind relationship and how it changes in performance, more so what we just talked about with that inverted U pattern. But there's not as much support as we would like to see with this theory. So there's merit to this theory, but maybe not as much as some of the other theories that we'll talk about. So what this theory tries to do is, instead of just looking at the basic rundown of, level of physiological arousal and performance, this theory tries to, hence the name multidimensional anxiety theory, tries to break that curve into two versions of it. One that is known as a low cognitive anxiety and the high anxiety theory, high cognitive anxiety theory, or yeah, chart. And on the left hand side, when someone is again challenged with a low cognitive anxiety task, or they're feeling some level of low cognitive anxiety, um, although their arousal can stay, can range from low to high, their performance can't be maximized. And that's very different from when you look at, on the right hand side, an anxiety task, anxiety feeling that's making the person really have significant thoughts to a certain point. With enough physiological arousal, there can be much higher performance, but there can also be much higher a steep off, if you will. But again, as we just saw in the earlier slide, not a lot of research to back this up. What is more common is what we looked at earlier, where we have a more traditional physiological arousal. As it goes up, performance goes up to a certain point, and then you start to see the back end of that inverted U. Reversal theory. How arousal affects performance depends on an individual's interpretation of his or her arousal level. Really important, because some situations can be stressful in a negative way to others versus some situations can be stressful in a positive way to others. And again, that is tied into closely with coping mechanisms, how someone views what is happening. And of course, if the arousal, the physiological arousal that a person is going through during a game, during a season, so on and so forth, during performance, is interpreted as pleasant, we're going to see increase in performance. But if it's interpreted as unpleasant, we're going to see a decrease in performance. View is very interesting. Not a lot of studies at this point to make some conclusive statements on this theory. But if you think back to personality, remember that I believe it was the fifth theory that we talked about, in which not only did that fifth theory, the more cognitive based theory, talk about the relationship between the trait approach and the interaction approach, or I should say the trait approach, situation approach, and how they came into the interaction approach, but also looked at, it was the phenomenon approach, looked at how the athletes interpreted that information, how they interpreted their own self-awareness of that relationship between trait approach and interaction approach, or situation approach, excuse me. And that could change everything. And same thing here. What is unpleasant for some person, for one athlete, may not be unpleasant for the other. What arousal can cause one individual to feel, the other individual may not feel the same, and that can influence what the performance ends up being. One of the later things here that I think is important to talk about is anxiety, direction, and intensity. We saw direction and intensity more so, yeah, I guess we could say that we saw this as well when we define motivation. Um, but it's important to know that when we talk about intensity, of course, it's a level of how much the person is feeling and direction in terms of if they're using that anxiety to fuel the performance to make it better, or if it's significantly, uh, being destructive to the performance, or if it's harming the performance. A couple other important things to consider here, sort of like some couple of highlights from what we've mentioned at this point. Viewing anxiety as facilitative leads to superior performance. So embracing anxiety to a point as an athlete and using it to help motivate you can lead to superior performance. State anxiety is perceived as helpful or harmful depending on how much control the person perceives. So, in other words, if the person believes that they have a control over the situation, they can flip the switch whether or not they want to see it as a positive thing or a negative thing. Some support for this view, and you know, like some of the other theories we just mentioned, there's a little bit of a mixed philosophy with some of these things, but ultimately, we want people to view anxiety, not just anxiety, but also arousal and stress, as positive things when they're relatively low level or mid level, or at least at a level where their coping mechanism can handle them in order to improve performance. And how do we do that? Well, we teach people cognitive skills and strategies, which again, like the comment I made earlier, when individuals, whether it's athletes, coaches, people involved in physical activity, they can't do those things themselves. They bring in people like sports psychologists to teach them these skills and strategies. And we're going to learn about a bunch of these throughout the semester. On the back end here, we're just going to reinforce a couple things I think I might have mentioned earlier. Why arousal is important and how it ties into performance. So of course, there needs to be a physical activation of arousal, or I think about some of those psychological signs that came from different physiological findings that led to arousal. Interpretation of arousal, is arousal good or bad? It's about what the person interprets it to be. Optimal mix of these emotions is best. I think that's pretty straightforward. Again, we want there to be enough, right? We want people to be engaged, excited, focused, but not too much where they're missing things or they don't have the appropriate coping mechanisms and they start to get in their head and not perform as well. Optimal mixes related to emotions, right? At least arousal related emotions are highly individual and task specific. So for certain individuals, they might need a little bit more arousal to perform well, while others can function at a much lower arousal and do the same level of performance. Again, that could vary on this person, of course, and on the task. We said earlier, one of the things that we talked about was the fact that if someone was doing a complex task in front of a group of people, based on the social facilitation theory, they're more likely to have poor performance versus something that they've done many times before. Again, that can make the task be the differing factor in the different optimal mixes of arousal related emotions. Some things that we actually see. So we've talked a lot about theory, about some things that will happen. So what do we actually see? Well, as arousal and state anxiety increase, we could see things physically such as muscle tension, fatigue, coordination difficulties. So again, as if those are too far high or too far gone, again, those arousal, stress, and anxiety levels where coping mechanisms don't work during performance, these things, of course, are going to lead to a lack of performance or poor performance. We can see changes in attention, concentration, and visual search. So there's a narrowing of attention, decreased environmental scanning, shift to dominant style. And that one's really, really important, because what that means is if you're teaching someone a technical skill, um, you know, let's say it's basketball and someone's shooting a jump shot, and their jump shot is no good, and it's not a good technical jump shot. They don't make a lot of shots, and you spent the whole off season, let's say as an example, working on the jump shot and develop a much better jump shots more consistently better. But then a situation of arousal comes up, and then they're not able to handle that arousal appropriately with the appropriate coping mechanisms. Maybe they default back to their original dominant style where they were lacking that fundamental jump shot, and they go back to missing, or they go back to not performing as well. So that would be a situation in which a lack of coping mechanisms leads to negatively one of these consequences. We can also see performance worries and situation irrelevant thoughts, starting about other things unrelated to the performance, differences in identification and processing of visual cues. I'm sure all of you have seen some of these, particularly if you watch any sort of sport, have seen these kind of things take place. And arousal, again, if it's uncontrolled, if it's not handled the appropriate coping mechanisms, such as or just like stress and anxiety, then yeah, it's no surprise that these things occur. Let me just clear this out. All right. So knowing that some arousal, some stress, and some anxiety is good, but too much is negative to performance, what can and should sport and exercise psychologists consider? Well, they should identify optimal combinations of arousal related emotions for best performance, getting people excited to perform without getting them overly excited or overly stimulated so they're unable to focus, recognizing how personal situational factors interact to influence arousal, anxiety, and performance, particularly if someone has trait anxiety, if someone's just naturally a more anxious person. Again, that person might need a different approach, some different lines of communication versus someone that's not. If someone is developing increased signs of increased arousal and state anxiety in certain states, certain times of the performance, maybe addressing those times particularly and understanding what's going on. And then, more important, really encompassing everything we just said, tailoring coaching strategies to individuals. Sometimes arousal must be reduced, other times must be maintained, and other times facilitated. So, and sometimes people are overly aroused, overly stimulated, and they need to be calmed down in order to perform well. Sometimes they have the right level of arousal, stress, and anxiety, and that needs to be maintained as the performance goes on, and they need to learn strategies to maintain their excitement, their arousal. But other times they may not be aroused enough, from the standpoint of not being able to focus enough, not being able to be engaged enough in the task at hand. And that maybe needs a little bit more of a push from the coaching side of things. So I thought this slide here, this one comes right from the text, was a pretty good way to finish up this module. Of course, state arousal or anxiety is a huge factor that's based off of what we've been saying over the past couple of modules, personal factors and situational factors. Again, that relationship between the two. So understanding how these possible sources of stress and anxiety play a role into what the person is developing. And again, we've looked at, we talked about these specific examples earlier on in the module. And then just for your references, in case you're a little shaky on some of these are some very common symptoms of arousal and state anxiety, particularly when they become excessive, right? They when become excessive and people don't have the ability to cope with them appropriately, and it starts affecting performance negatively. So when we work with athletes, this is what we're looking for. And when we see these kind of things, and start having a negative effect on performance, again, we start looking for coping strategies to uh, alleviate them, right? To make them better. All right, so that is it for our fourth module, and we will talk soon.